In this video, I'm going to talk about Black Death, also known as bubonic plague. We're going to explore what was thought to be the cause of the plague in the 1300s and how it was managed in comparison to what we know now and how we would manage such an infection in this day and age. I am a medical doctor and I work as a general practitioner or a family physician in the UK. I do also love history and I find it really interesting exploring how medicine was practiced throughout different ages. So if you share my interest, please follow my channel, Doctor of the Ages. So let's start with a bit of background. The bubonic plague was a cause of one of the three major pandemics in history. It affected Europe and wiped out about a third of the population in the 1300s. A lot of us will have heard of plague doctors that were employed by the local authority to care for affected patients. Although they were normally physicians, their understanding of disease was based on miasma and the theories of humoral imbalance. So essentially, miasma theory was the belief that diseases were caused by bad or polluted air arising from decaying matter. They also believed that the body had four humours, including blood, phlegm, yellow bile and black bile, and an imbalance of any one of these they thought could cause disease. So this has all now been replaced with the germ theory, which identified microorganisms as the true cause of infectious diseases. So infectious diseases are caused by either bacteria, viruses or fungi. So now we know that bubonic plague was caused by a bacteria called Yersinia pestis. This is transmitted through the bite of an infected flea, and these fleas had likely been living on rodents like black rats. It can then be transmitted to other people through respiratory droplets or contact with bodily fluids from infected individuals. So after entering the body, this bacteria can cause enlargement of lymph nodes, it can cause sepsis, it can spread to other organs like the lungs. This was known as pneumonic plague. It can also cause bleeding into the skin, membranes and organs, and this was known as hemorrhagic plague. And this gave patients the blackened appearance, hence the name Black Death. So our understanding of infections has come a long way. Going back to the plague doctors, they had protective outfits. So the most distinctive feature was the beaked masks that they wore. They were actually filled with herbs and spices which were believed to purify the bad air or miasmas. So the beak was designed to hold these close to the doctor's nose and protect them from inhaling the air of infected patients. They also wore a long overcoat to protect against bodily fluids. They had gloves to avoid direct contact, and they had boots to prevent contamination from the ground. They also wore a wide-brimmed hat so that you knew that you were seeing a plague doctor. Nowadays, we have personal protective equipment or PPE when we see patients. So this consists of a mask that covers your nose and your mouth. You've got gloves and an apron. So actually looking back, the PPE from that time wasn't really too bad. So based on their theories, plague doctors would isolate individuals, households and even neighbourhoods to prevent the spread of the disease. And to be honest, this probably wasn't a bad idea and likely it would help reduce the spread of infection. But they would also use techniques like bloodletting to purge bad blood. And this was an attempt to restore balance to the body's four humours. Now we know that bloodletting would lead to complications like anemia, weakened immunity, and something that we refer to as hypovolemic shock. So this is actually a medical emergency that occurs when the body loses a significant amount of blood or fluids, and that then leads to poor circulation and oxygen supply to vital organs. So actually bloodletting would probably do a lot more harm than good, and it's not a technique that we use nowadays in the treatment of infections. Herbs were also quite popular in treating infectious diseases at this time. The main herbs used for the plague were mugwort, garlic and sweet flag. And although these herbs do have antimicrobial properties, they weren't really enough to eradicate Yersinia pestis, which was the bacteria that caused the plague. People would also try and cleanse the air with things like incense, vinegar, roses, but now we know that there's very limited scientific evidence to support any of these as effective infection prevention strategies. So evidence that we have now suggests that measures like hand washing, disinfecting surfaces, and proper ventilation are more effective in reducing airborne pathogens like Yersinia pestis. Also, with Yersinia being a type of bacteria, we would now treat infected patients with antibiotics such as streptomycin or gentamicin, but unfortunately antibiotics hadn't been discovered in the 1300s. So we are very lucky now, as many infections that were fatal and life-threatening in the medieval period are actually now treatable quite easily with antibiotics. So if you enjoyed this video, please do like and share with others. If you would like to find out more about the history of medicine through the ages, then please subscribe to my channel, Doctor of the Ages. Thank you very much.